When I track people, let's say with advanced autoimmune disease, with long haul COVID, POTS dysautonomia, any of these like quote unquote impossible to treat diagnosis, I can tell you right now, 100% of them were born with some part of their digestive steps weak or broken. And what happens is it just starts to escalate. It starts to escalate. I'm going to give you guys one mechanism to think about. Okay.
Today, we have another very special guest, Dr. Maggie Yu. Dr. Yu is a family practice physician and a certified functional medicine physician who's been practicing for over 25 years. She also happens to be the author of the book, 8 Out-of-the-Box Ways to Transform Your Health. Dr. Yu, welcome to the Functional Nurse Practitioner podcast.
Thank you for having me, and I'm ready.
We are so excited you are here. I'm sure the listeners would love to know more about you, Dr. Yu, the why behind your journey into functional medicine. I say this all the time because it is very true. Those of us who travel down this pathway have done so for a reason. So, Dr. Yu, tell the listeners, who is Dr. Yu? How did you happen to travel down the functional medicine highway? And why should we listen to you?
Sure. And everybody calls me Dr. Maggie. Feel free to call me Dr. Maggie. And for your audience, like most functional medicine providers that went down this route, we got sick ourselves. So for me, I was a practicing let's go back even further. I graduated out of UCLA, one of the top medical schools in the country, loved my training there, came out as a family practitioner, loved being a family practitioner, and loved teaching. I ended up being medical director, one of the largest medical groups here in Oregon, and I ended up training other family physicians. And I went that route until I got sick myself and became the sick patient. And I realized I don't know if you know, but the audience may not know, in the back room of most family medicine clinics or even gynecology office, you will hear the common lament is, we're huffing and puffing about dealing with the woman who's between the age of 30 and 55, who's complaining about being tired and all her labs are normal. And there's more and more escalating type of symptoms. And with those quote unquote labs being all normal, there's really not much that we could do for that person. And, and I touted that line until I became that sick patient myself. So, it's through the birth of both of my kids, postpartum, I really got kick-started my problems with my thyroid. I didn't know it was thyroid at the time. I started developing fibromyalgia, TMJ, chronic pain, neuropathy, depression, anxiety, got diagnosed with ADD as an adult in my late 30s. And all of that really came like boom, boom, boom after the birth of each child. And it just never went away and just got even worse to the point where I got into early menopause by the age of 36. And it was, this is 20 years ago, and at that time, understanding women's health, bioidentical hormones, autoimmunity, none of that existed. I had to claw and fight my way to learn about those things to save my own life. And then as a result, really embarked on a journey for the next, 20 years, focusing and specializing in these areas. Because once you learn based on your own suffering, you become the master teacher of where in the area of life where you have the greatest suffering. So I'm really thrilled now that I love being a teacher, meaning I teach regular people and providers how to solve these seemingly unsolvable mysteries that in fact are real problems, real patterns that are being ignored by the general conventional medical world.
Well, I love your story. And with my background in women's health, I absolutely relate to that image of somebody with normal labs, but hey, I just don't feel well. And there's not a lot there, unfortunately. And I actually was hoping we could start with your book, if that's okay with you. I just happen to have a copy of it right here. And I made some notes. And so the book, again, 8 Out-of-the-Box Ways to Transform Your Health. There's a few passages in particular that really resonated with me. So the first, and I love this. One early morning, sitting on the bathroom floor, crying quietly to myself, I had a revelation. There's something about rock bottom that helps you realize doing something, anything different, would be a step up and out. Yeah. Like that, I feel like that was me sitting. I don't know if I was actually on the bathroom floor, but definitely on the side of my bed, sobbing, thinking I'm hopeless, that there was nothing, no place that I could turn. And so absolutely this resonates with me. And then another is realize that you're not alone.
Mm. Yeah. I know that moment well. And I think the other piece of this too is when we're talking about women's health is I was also in a abusive marriage. And so it's interesting how like there was an intersection of many lows at that moment. Not only was I physically from a health standpoint at my lowest point, mental health standpoint, I was at my lowest point. My brain fog and lack of focus was so bad and depression that it was affecting my career. And then from a relationship standpoint, I was also at rock bottom at really the depths of hell of an abusive marriage, at the end of an abusive marriage. And I think even one of those would be crippling. But most women that I meet are dealing with not just one, but typically multiple lows at that level. And it took me to that low to really realize I just have to do something different, and anything different would be better than this, because there's nothing that I'm doing that I'm currently doing that is different. So do something different. If you expect a different result, Einstein said this, you can't expect doing the same thing that got you the same outcomes. And you can't continue to do those same things, or to operate in that system and expect a different outcome. That's just asinine, right? And so I'm a fan of the cursey word. So I realized at that point was I sure as hell needed to do something different and everything different.
Well, I love that, even down to the cursey words. That's me to a T. And another thing that you wrote that I actually say this, I feel like on a daily basis with the people that I work with, know that you're not a unicorn. Your problems can be fixed.
That's the piece about aloneness. I think that is one of the greatest sin when we feel like we're alone, is that not only do you feel alone, number one, but you feel like a lone unicorn, which then makes it that it doesn't solve the problem to get more people around you. If you truly believe that you're some super special rare zebra, I call it, to the point where you think you're this magical unicorn, and you truly believe and identify with that identity, you're right, then there is nobody that can come help you. And that's an identity. That's an identity. And if you have an identity that you are a super special rare unicorn with a super special rare medical problem or diagnosis that no one can solve, then you're right. And I don't want you to be right there. And I can tell you're not right there. But I have been myself, and I have met many people who not only feel alone, but it translates into an identity of being a rare unicorn. And they become their greatest obstacle to their own solutions, because that belief and that identity in itself becomes the obstacle.
Yes, I also speak about on a daily basis that this and this are crucial when it comes to everything about our life. But in particular with disease processes that happen, autoimmune conditions, whatever it is, with cellular physiology just going awry, we're designed to not only survive, but thrive. And if that's not happening, there's a reason.
Well, and this goes back to just even tying back to women's health and hormones. And I want you guys to think through this, which is I was diagnosed at 36 with early menopause, right? And without anyone testing my actual hormones, because God knows we don't test hormones, right? Number one.
And we don't test them the right way.
Correct. But at that time, we're talking 20 years ago, but even now, when you go and ask, I begged and finally had my FSH tested, which is one test to show whether you're in menopause or not. That number was like 80, which in a conventional regular medical world defines you as having medical verified menopause. Okay. And I hadn't had period for like over a year. And interestingly, when I went to my colleagues, the response was, and by the way, no 36-year-old woman who's healthy should be going through early menopause at the age of 36. That is not normal.
No.
And I asked my colleagues, and myself not knowing the answer, I'm like, why is this happening? And the answer was, you're just getting older. Now, here's the thing. I didn't know anyone else at 36 who got older by being in menopause. So number one, that answer wasn't correct. Number two, I felt really alone because me, even as a practicing physician, didn't see that many women at the age of 36 with early menopause, right? So I started to believe, and it's also reiterated by my partner at the time, but also my doctors, that I had some, if it wasn't me getting older, then I had some super special, rare thing that was going on, and I was the only one. And the more I asked for answers, the more we become the difficult patient, right? And the more people, right? They're like, because I'm like, that doesn't make any sense. Why is this happening? I will give you guys a hint though. What I discovered, and this is a answer that took me maybe 5-6 years to figure out. I say this now, but nobody else is saying this. And I'm sure you've made the connection. But here's a hot tip, and you guys want to take notes, which was, at 36, it was about 2 or 3 years later that I discovered I had an autoimmune condition called Hashimoto's, which is an autoimmune attack against my thyroid.
Are you currently suffering with Hashimoto's? Have you been told there is nothing you can do? Are you tired of the never-ending fatigue? Are you ready to overcome the debilitating brain fog, anxiety, joint pain? I created a masterclass where we dive into the underlying root causes of Hashimoto's so we can get you on a different pathway. One that leads to not only improving your symptoms, but transforming your health. For now, I'm offering this masterclass for free because I know how it feels to keep searching for answers and coming up empty-handed. If you'd like to gain instant access to this masterclass, comment down below masterclass and I will send you the link. Now, back to today's episode.
Which is right up here around my neck, is a organ that makes thyroid hormone. Now, what does that have to do with my early menopause? Okay. If your immune system is mistaking your hormone-making cells in your thyroid as a germ and is actively trying to kill it, what do you guys think scientifically and logically your immune system is doing to other hormone-making cells that look almost identical to your thyroid cells that make hormones? What's the likelihood there's an autoimmune disease, there's an autoimmune attack against other hormone-making organs? 100%. And I discovered a pattern in myself, which is, do men and women with Hashimoto's and autoimmune disease attacking their thyroid, are they much more likely to have crazy ass hormone patterns that are because their ovaries and their adrenals are under attack as well because of the autoimmune disease? And the answer was hell yes. There was a hidden mechanism that to this day doctors don't understand, and even functional medicine doctors don't understand, is that this autoimmune attack isn't just about one organ or one target. When someone has any autoimmune disease, the likelihood there's other mechanisms where it's under attack by their own immune system of any target is 100%. This is why I don't just have Hashimoto's. I have an autoimmune disease yet unnamed because there's no blood test to diagnose it except for the results. I have an autoimmune disease that also attacks my ovaries, my adrenals. I also have mixed connective tissue disorder, right? Against my connective tissue, right? So my joints. This is why over the years, even at the age of 21, when I herniated the disc in my back, I never healed. I always had left leg pain, numbness. I also have neuropathy, which is damage on my nerves, right? Which I know now was because of autoimmune attack against what? Nerves. So these are hidden patterns and connections that we're not making for someone coming into our office, our average 40-year-old woman who comes in saying they're tired and they're gaining weight and their labs are normal. This is literally a treasure trove underneath of connections that are missed. And it's so common. It's so hot damn not a unicorn that it drives me insane. And this is why I have a mission and a passion for opening the lid up. And that's what I did in the book, is opening up the layers of connections that we are missing in functional medicine and regular conventional medicine.
Well, go out and grab a copy of this book to all the listeners. And I also wanted to back up just a bit. 35, 36 is, we can have perimenopause, which could last more than a decade.
Correct.
But menopause is not
normal.
Common. It is not. Yeah. That is not what should be happening at that age. And, you're definitely speaking my language with the immune system. This is what I am alive for. I feel like I was in women's health. I loved it. I loved what I did. But, you know, it's kind of like we're on a hamster wheel, just pacifying. You got a few minutes. Yeah, you're tired. Although I never said it's just because you're getting older. So I'm going to be 50 this year. I ended up also with Hashimoto's that I had to find because I ended up with a very enlarged thyroid, couldn't swallow solid food. I was told I had lymphoma, spent months of my life believing I had cancer, which is my background was in oncology.
Yeah.
It was the most terrifying experience of my life, and conventional medicine left me with nothing, which is why I went back to school to IFM, which changed my life.
Yeah.
Now I am, every single day, I talk about the immune system. I'm working on something right now that to transform lives because of how passionate I am about the immune system.
Yeah.
And now you spoke about that underlying Hashimoto's could cause hormone issues. How about
adrenals and even your digestive tract, FYI?
Okay. And I'm so excited because these are some of the questions that I wrote down. So how could hormone imbalances be the triggering event leading to autoimmune diseases?
Oh, yeah. So it's not even how, it just is. It just is. So here's what I discovered. Because I basically 20 plus years ago, I became a bioidentical expert MD that didn't exist. There was no MDs at that time that knew a jack, about bioidentical hormones. I started testing, I started prescribing, I started to understand there are also different groups in that group. Why is it some people got bioidentical hormones and boom, that was like the solution for the rest of their life. Other people are constantly adjusting their dose and still not better. And there was all these other health issues. Well, because those people, there's a huge group of people who were experiencing more hormonal symptoms because they had an underlying autoimmune disease. Okay. So it's almost like someone who you can't just give a dose to and they're good, has an unstable issue going on underneath that if you don't figure out what it is, you'll never solve that problem by giving them the same dose of thyroid hormone or hormone therapy. It just doesn't work. You got to think bigger, like what else is going on with this person? So that's what I discovered was that I started to see people, men and women, and even children who have very fluctuating or certain specific types of hormone patterns that doesn't make sense for their age group or where they're at. And they don't respond normally to just taking a hormone or a thyroid medication, that there is an underneath mechanism that's responsible for those hormone fluctuations. So it's chicken or the egg. Is it that someone has an autoimmune disease that's attacking their ovaries, adrenals that causes them to have those hormone fluctuations? Or is it the hormone fluctuations themselves are actually triggering the autoimmune attack? I'm going to say both. And this is why I'm going to give you an example using postpartum after the delivery of a baby. And many of your listeners start going back and thinking about yourself. And this is evidence. So how many women, after they deliver a baby, each one or just one, that was the onset of a lot of their health shit show. I was one of them. I was considered healthy, all this. I delivered my first child. During that pregnancy, I had gestational diabetes, which is, by the way, a hormone problem with insulin, right? And after the delivery of that baby, I had severe hair loss, weight gain, severe postpartum depression, and a life-threatening infection with C. difficile. Okay. So then after the birth of my second baby, actually, the moment I found out I was pregnant with my second child, I was immediately an insulin-dependent diabetic. Okay, another hormone problem right there. At the moment that my hormones changed, the placenta makes hormones, HCG. The elevated levels of HCG with pregnancy immediately caused a change in my insulin levels and sensitivity. And I had to take insulin immediately, right? And then after the birth of my second child, I developed severe fibromyalgia, neuropathy, mixed connective tissue disorder, right? And a lot of histamine, allergy-related issues reacting to food, right? So where did all this come from? And what people don't realize is that the pregnancy causes a humongous change in your hormones. So HCG will go up like crazy, but then your other hormones like progesterone or even estrogen, some of these other hormones will be suppressed during pregnancy. Big swap the moment you're pregnant. And here's the thing. The biggest swap happens when you deliver a child, because you're not just delivering a baby, you're delivering a placenta.
Yes.
Placenta is a huge hormone-making organ that when you deliver the baby, goes out with the baby. It's not the baby with the bathwater, it's the baby with the placenta. So what happens is that immediate delivery of the placenta, oh, holy shit, is probably the most dramatic short period of time hormone shift in a woman's life. So that is why that boom, drop right there, literally will impact on all the other hormone systems in your body. Your ovary hormones change immediately. Your adrenals hormones change. Your brain hormones changes. This is why there's postpartum depression, right? And the hormones that regulate digestion and gut movement, all this stuff changes immediately. So what you see is, boom, that's the triggering event, because all the other hormone systems get impacted. And then we see IBS, we see joint pain, we see nerve pain, we see ADD, depression, brain fog, like all of it after postpartum. That to me is the best demonstration that shows you that when hormones shift really fast and really big, it is the triggering event that turns on everything else. So I know for a fact that hormonal shift is a triggering event in many chronic diseases, including autoimmunity.
Yeah, let's underscore that for the listener. Definitely the placenta, for those of us with female parts, we deliver an organ. I don't think enough, I don't think that's common knowledge, to be honest.
It's not.
That it's just kind of like, oh, just get it out of there and get rid of it, except wait a second, I grew that organ and now it's gone and it's going to have an impact. And when you said, for the listener, thinking back, if they've been through pregnancy and delivery, to how they felt, so many individuals in my practice, that's the moment. I felt great until I was 30 years old and was pregnant, until I was 27 years old and was pregnant, and nothing's the same. And now I have, joint pain, and I'm brain fog, and I have thyroid issues, and my hormones are a mess. And everybody tells me it's all in my head because my labs are normal. And that is very, very frustrating. And I am so glad you are here, Dr. Maggie, to debunk this for the listeners, because it's that important. And you alluded to this and said that the gut has so much to do, the role with the gut. I would love for you to expand on how the gut has anything to do with autoimmunity.
Oh, huge. So I'm not just, Dr. Hormones or Dr. Autoimmunity. I would love to be known as Doctor of Digestion, Dr. Digestion. I would say that, we're both have had training with IFM. And for me, though, one of the things I think people don't realize out there, just like the whole placenta delivering an organ, is like people don't really understand that. I feel like digestion is the most misunderstood, misrepresented field in functional medicine and conventional medicine today.
I agree.
I really do. And I love every single piece and step of digestion, because it's literally like, and I teach a master level course in digestion, and every single step, we realize is that there's a genetic component to it, meaning like we are born with certain almost genetic code and wounds where one or multiple of those steps may be weak, right? When I track people, let's say with advanced autoimmune disease, with long haul COVID, POTS, dysautonomia, any of these like quote unquote impossible to treat diagnosis, I can tell you right now, 100% of them were born with some part of their digestive steps weak or broken. And what happens is it just starts to escalate. It starts to escalate. I'm going to give you guys one mechanism to think about, okay? So on the front of it, digestion is there to take big pieces of food particles and break them down into tiny, tiny food particles. Tiny, right? When they're super tiny, they're super absorbable, but they're also really low in allergy, low allergenic. Okay. So if you were born already and some steps of your digestion is already weak, you can understand then why some of these individuals over time develop more and more allergies, whether it's eczema, allergies, or food reactions, right? Exactly. And so what happens is you're born with some of those steps weak, but the problem is over time and over a lifetime, some of those get broken. And we even prescribe medications to break them on purpose because that's what doctors do because we don't know any better. So what happens is that there are certain assaults on your digestive tract as you go along. Let me give you an example. Let's say long haul. Okay. We know for a fact that the big C virus actually infects the gut. It's not just, ear, nose, and throat or your lungs. We know it infects the gut. What happens when your gut cells gets a virus going in there to infect it? Can it affect your digestion? Yeah, this is why there's so much GI or gastrointestinal effects when some people get the big C versus other people. And that has a serious impact on digestion. So it can further break down some of these steps. So that's an infectious assault. So why the hell now are you seeing 65 million people around the world diagnosed with long haul, and the number is underscores. I think only a third of people get diagnosed. I think 2/3 don't. So I think at least 250,000 people on the planet has long haul of some type. So now do you understand why so many people with long haul have imaginary illnesses? Because it was this ear, nose, and throat thing, a pneumonia thing, right? But now they're walking around, oh my gosh, I have heartburn, I have bloating, or now when I eat food, it doesn't feel right. Or why the heck all of a sudden does it feel like I'm reacting to every single food when I didn't before? And it's because there was a further assault on their digestion. And just this one mechanism, the more steps in digestion you get broken, the more food allergies you get is a medical fact that's completely lost in the medical establishment and in the functional medicine world. So this is why Halsey, let's bring this to Halsey, just got, if you look at Halsey on the news yesterday, just revealed that she has 5 diagnoses. And I'm just going to list them for you guys. And I see a pattern here already. So lupus, autoimmune disease, okay, attacking multiple targets in your body. Sjogren's, attacking, some of your gut, your spine, right? Multiple targets in the body. She's diagnosed with POTS, postural orthostatic tachycardia syndrome. Most people think of it as a heart problem. It's not, but it can cause blood pressure and heart rate changes, right? Mast cell activation syndrome, which means that she's throwing tons of allergic histamines to every single thing, food item, or even environmental that happens. Right? And she genetically had something called Ehlers-Danlos syndrome, which people think it's a genetic disease of the joints. No, it's an autoimmune condition. Okay. So we're seeing more and more now that these people come up with these quote unquote unicorn illnesses, 5 of them in one person. And bottom line, Halsey was born with a digestive issue and an inherent weakness in the first place. She had a genetic predisposition to autoimmunity by having Ehlers-Danlos syndrome. And then later on, stress, diet, all those other infectious type of organisms can come in and add layers and layers to turn on more and more of these disease states and diagnosis. But it sure as hell started with digestion.
It's almost as if you're saying the whole body's connected.
Yeah, think?
And I get a little salty sometimes on this podcast.
Please.
when it comes to other practitioners, and for the conventional medicine folks out there, it's not in the training. No. It's not in the training. My training was amazing. My nurse practitioner training about how to diagnose and what the steps to take, and if this schematic, if you're this sex, if you're this age, you do this, and that's great for acute care, but it does nothing for chronic. And in the functional medicine space,
yeah,
this is where I feel like we're in alignment with this, and I love IFM, and the reason that I'm so passionate about spreading the word about functional medicine, even though I get very frustrated with a lot of functional medicine practitioners, is because the training received from IFM wasn't just ridiculously generic protocols where, I thought I had cancer, I had lymphoma. So I know RCHOP, and I'm like, can I get through that regimen? And my husband's like, wait, you're going back to school now? you work full time. How are you going to do this and get chemo? I'm like, I'm looking for a way to survive. So I'm over there in the chat, like, what do I take? What supplement? What do I do? What's the protocol? And there is none, because what's my trigger? What's my issues? Yeah, genetic predisposition. Both of my parents died in their 50s, lots of autoimmune diseases. And I was told there's nothing that I could do. I was formula fed, you know? And so there, it set me up right early on. And you talk about skin issues, eczema, check, you know, I had that issue. And then when I went through everything that I went through and I started doing expanded functional tests, I was doing these expanded functional tests without understanding how to read them, right? When I first started. So here I am spending $3,600 on tests. Yeah. I'm reacting to everything. So mast cell activation syndrome, check. I'm allergic to literally, so for the listener, if anybody runs a test on you and they tell you, you can't eat anything, you're allergic to everything.
It's bullshit.
It is bullshit. And, you know, it fires me up, because we need more functional medicine practitioners, but we need there to be, first of all, real training. So that's why I love IFM and get certified, because it matters. And really just looking a comprehensive approach. So I love what you're saying. It's really speaking with me, and I feel like it's really going to resonate with the listener. Well,
but here's the thing. I think absolutely providers need to get the training. But what I see completely lacking, and what you're saying lacking, is real world wisdom and experience. And I think the reason that you and I have put together as much as we have, I feel like that's missing in that type of education, is that we suffered in those areas ourselves, and to save our own lives, right, we had to start making some big connections. It was like we practiced on our own sicknesses. And on the patients that we treat, we realize, wow, after 27 years here of experience with this, I see all these other pieces that weren't being taught, right? Or they were taught in a basic, but like the way that I just connected digestion with all of these pieces in other pieces of health, or in looking at someone like Halsey, 29-year-old, they with all these symptoms, it's not something that you can just teach at an IFM certification over 1 week for this course or that course or that course. I think that real life experience in people who I say are pattern seekers, like you see patterns and I see patterns, we have a super skill in that. I think most people, that is a talent. Not everyone has it and not everyone wants it. So I think that it's important for people to seek out people who are seers, who see these patterns, who make these connections, have made it in their own lives, and is passionate about sharing and teaching this to others. Right. So I think that's a different skill set that people need to be looking for when they're looking for providers or programs or people they want to work with.
Yeah. Take out your notebooks, friends, write that down, because 50 plus individuals that have come to see me, seen numerous other functional medicine practitioners. No one did a timeline in Matrix. Mm-hmm. When I asked about their triggers, they didn't know what I was talking about. Mm-hmm. How are they Again, I don't want this to be like a slam fest. I want it to be empowering.
Let's give our audience the behind the scenes of what it's really like in the world of functional medicine providers, quote unquote. Because I think I'll be honest with you. I hate that term in a sense, because we work with thousands of individuals every year in our programs, and that is a common question. People will say, "Oh, I just want to find a good functional medicine provider." And I'm like, you can't use that term. You really can't, because that term doesn't tell you their accreditation, their certification, their experience, and their talent for wisdom. So I ask people to get very specific about what is the area in your health you need a functional medicine provider for. So if you say hormones, I go, great. Okay, let's say that's the area. Well, here's the problem. You go into that hormone area. How do functional medicine providers make money? Okay, so then the second thing you have to do, and I write this in the book. So by the way, the first chapter is lead with curiosity, and I have questions that you need to ask providers, okay? But how your doctor gets paid, your medical provider gets paid, will completely determine the menu of services that you get. So 95% of quote unquote hormone experts run what I call pellet mills. right? So that means that they make their money by selling the highest number of pellets, because they're not, when a doctor, like, let's say, recommend, a compounded hormone, the pharmacy makes the money on that. They don't. So then they can only make visit on maybe what they charge for your visit, because insurance won't pay for this, right? So then you may have to pay a high price for that visit. So you'll get a lot of time, but let's say. But the other way that these hormone providers make money, bigger money and easier money, is to get everybody on a hormone pellet rotation. So you come in every 3-6 months for your pellets. Doesn't even require them to have somebody shoot the hormone pellet into you. But is that even the best way? Getting bioidentical hormones doesn't mean that you have hormone balance. And the worst way to get bioidentical hormones is through pellets. And that's the most common way to get it in a functional medicine practice, because that's how they make money. So then you got to really, this is an extra level discernment I ask people to ask questions about, is how's my provider going to make money? And is that going to be serving my highest interest? Right?
That I love that you said that. And I've never heard anyone articulate it like that. And aside from the fact that if we give a hormone, what is it doing in the body? Just because we flood it into the system doesn't mean the body is using it.
It doesn't. That's correct. And that's the word flood, right? So I am a bioidentical hormone expert. I am not against hormone therapy for people who need it, but I'm not about hormone flooding. I'm talking about really understanding someone's pattern, underlying issues that they have with autoimmunity or their gut or other things, and supplementing, yes, with bioidentical hormones at the lowest doses possible, designed to encourage your body to actually make and balance and break down its own hormones naturally. How can we work with our body to actually get the best results? Hormone flooding doesn't equal hormone balance, but that's what 95% of the functional medicine world is doing unwittingly. They don't realize that that's what they're doing. So that's the difference. I'm not against bioidentical hormones. I'm not even against functional medicine providers. They got to make money to survive. So do I. But really, do look at that and question that, so you understand the menu of services that you're going to receive.
Yes. And I'm a genetics nerd. I prefer to know, if at all possible, a genetic predisposition.
Correct.
For the hormone metabolism and to follow hormones, because just checking blood levels doesn't say, are we going down a carcinogenic pathway?
No.
Like I had this, aside from all my other issues that I've already mentioned, and those who follow me probably know this also, I had crazy hormone problems for so long.
Shit. I could have told you that. Just by your history. Nobody gets cancer, or Hashimoto's, who doesn't have crazy ass hormone problems that nobody's uncovered. Right?
Yeah. And the answer is just for the crazy ass hormone problem, to just give hormones. That solves the problem. Right. That's what we say. It solves the problem. It didn't solve my problem.
Nope.
So these crazy periods, bleeding, not to be gross, bleeding through my clothes,
me too.
cysts, dense breasts, crazy mood swings. I was like a batshit crazy, for so long. And I don't have any of those issues anymore.
You don't have to, because when you understand what the underlying problem is, she had symptoms relating to what we call polycystic ovarian syndrome or metabolic syndrome, along with Hashimoto's. Those two commonly go together. And so it's really important for people to understand, there's a lot more to this in genetics, in inflammation, in food, in digestion, right? And because of our understanding, I have 1,000 tools for somebody with these problems, not whether you get on hormones or not. I was put on birth control pills for those very same problems in my early 30s. Maybe worse. I was put on antidepressants. I was told to get marital therapy and therapy to handle my abusive husband, right? That's the kind of shit we get told to do. And, and I was prescribing those for patients, right? Myself, until I became that patient, received that sick care, and realized that there has to be, and there is, way bigger answers, and they're not hard to identify. They're actually easy to identify in the hands of the right practitioners with the right wisdom and experience and with the right financial motivations.
Yeah, you hit the nail on the head there.
Yeah.
You brought up a term, this hormone balancing. right? So hormone balancing versus hormone replacement therapy.
Right.
Could you speak a little bit more about that?
Hell yeah. And it was about the whole flooding thing. So I've talked about hormones. I have a hormone masterclass program where I work with people around the world. And one of the cases was Gillian. And she's a good demonstration of that, which was, oh, I'm seeing this. She's from the South. Sorry. Sorry, not sorry. She's from the South and she was talking about her hormones. We were reviewing her hormones. And she was on, and I'm just for reference, giving the medical practitioners here an idea of the dosing. She was on a bioidentical hormones called prometrium, and it's natural, it's prescription, right? And she was seeing somebody who she trusted to be a functional medicine provider for her hormones. Based on blood work, not even the right, I like saliva hormone testing, and some people like urine as well, but it was based on blood. She was told she needed progesterone. She got on. But because she couldn't sleep over the course of the next 6 months, she got on to 600 to 800 milligrams of prometrium. And still, she was told like she needed to go up on more. And meanwhile, she was getting acne, she was gaining weight, she was getting anxiety and all this because the provider she was seeing doesn't understand that these hormones break down the biochemistry into other hormones. Progesterone breaks down into testosterone. Testosterone breaks down into estrogen, none of which she needed additional doses of. And she wasn't even retested on what her hormone levels were. Mind you, she wasn't tested correctly to begin with. But we have practitioners here based on symptoms pushing people up on hormones and hormones and hormones because we're adjusting based on your symptoms. And she's on what I call a heifer doses of hormones, meaning I would give that dose to a cow.
Okay? Yeah, for the listener, that is in nowhere near, in my opinion, a safe, responsible dose.
Bullshit. Like you want doses that actually will cause someone to have a stroke or have a blood clot? That's the kind of doses you give. And this is a quote unquote trained, reputable, functional medicine provider, that she was working with. But that's not even unusual. This wasn't a unicorn case. This is what I see at least 1 to 2 times a week working with clients coming from other functional medicine practices. So the way that I think the way that conventional medicine just ignores this whole topic, right? Don't even test, maybe prescribe or don't prescribe. That's just where they're at. Functional medicine docs are learning how to, very basic, literally a 4-day seminar on how to test for hormones and then what hormones to prescribe or very little on supplementation or lifestyle, by the way. So, and what they're doing is basing on symptoms or basing on bad testing, prescribing hormones that aren't even correct or needed in the first place. And then secondly, using symptoms to adjust hormones and not reevaluating and retesting the underlying issue. The underlying issue for Gillian, she had fatty liver, which is a liver problem. So if you don't look at those hormone results and immediately realize, this woman shouldn't even be put on hormones because her liver can't even break it down. This is a shit show for disaster. And just this morning, I was reviewing in one of our programs somebody's hormones, and she should have never been put on hormones. Clear case of having a liver and digestion problem. And she was like, I'm so glad I'm here. I just left a practitioner's office about 6 weeks ago where I was told I needed to get on progesterone and estrogen. And they were through the roof. She wasn't taking it, and they were naturally through the roof. Why? Because she had another problem, which was a fatty liver problem. So they're missing these patterns. And so I'm literally horrified at the state of where we have functional medicine, no naturopathic physicians, quote unquote, giving hormones and calling that hormone balancing. And what they're doing is they're not hormone balancing. They're flooding people with hormones. They're adjusting, they're testing erroneously, adjusting erroneously, actually being irresponsible to me with this. And they're not getting people outcomes. People are getting sicker.
Yeah, and definitely we need to underscore that because I've seen a lot of people that have had like numerous different types of hormone replacement therapy and they don't feel better. And I am definitely not against hormones. I prescribe hormones. I care about that individual. How is their body able to break it down? Like you said with the liver. I mean, and this goes for anything that we're taking. If we're flooding the body with supplements, somebody's got a bucket of magical supplements. Can that person effectively break those down. And what is that doing?
No. And half my time, like I own a supplement company. But my philosophy around my supplement formulations and company is this, is that number one, people need to be educated on the why. Like they need to know why. Why do I need a particular supplement, if I even need it in the first place? What's the underlying why in me personally? And it's different for Gillian. It's different for Miriam. It's different for me, right? So number one is education, understand your why. And then that way, when you understand the why, the how is much easier to navigate, because then it stops being the question of what's the magical green medicine I'm going to take for this and this and this and this. 80% of the time in my programs and when I work with people, I'm talking them out of taking a supplement. Right? And what I love is saying, yes, in this scenario, you do need this particular supplement. Here's the why. Here's how you're going to take it. And here's how you're going to retest and when you're going to retest. And based on that information, you're going to learn to pivot, increase, decrease the dose, or even stop the dose of that supplement. There needs to be a total education on the runway, the lifetime, and what helps people adjust up and down on it. It's not a magic bullet. It's not a magic green medicine here on supplements. And for me, education is really the answer, and understanding that, there's also a lot. Most people don't even need those supplements sometimes if they really understood the true why and all the other tools that they have. It's just one piece of the puzzle.
So you're saying like the root cause of why they have the issue to begin with matters.
And it's fixable. Not only does it matter to identify it, but to know like you can fix it. It's not like, oh, I have this gene and I'm screwed. It's, oh my God, I have this gene. I have this crazy ass opportunity now. Because now I have 10 tools and not just one. And I'm not dependent on somebody else and their menu for what those 10 tools are going to be.
Yeah. And I know it can be very frustrating for people, individuals that have a lot of symptoms and not knowing. And I'm like you, I'm a fan of education. I'm like an educator at heart. I always have been. And not just saying, here, take this, but talking about what do they want? What's their why? I want to know their overall vision. Mm-hmm. It's called a wellness vision. How do they see themselves? Are they allowing the space for it? Or do they come to me and say, my body's broken and I don't believe it can heal because I'm not going to be able to do anything. I don't have a magic wand.
I have a very devastating conversation I had with a naturopath once. This was 6 years ago and I still remember it. And this has to do with identity. So really important, people, choose your identity very carefully. I had a naturopathic physician. This is when I just started our programs on autoimmunity. And I spoke with her and she was headed towards being on the liver transplant list. And she had huge autoimmune problems that was autoimmune against her liver. And so the question she had for me was, the questioner was like this. I said, well, I want to know how coachable and open are you to learning something different and doing something completely different than maybe even what you were taught, what in your training. And she made a statement. She said, there is nothing that you can teach me about botanical medicine that I don't already know. I said, well, then you're right. And she, and I can't work with an individual whose identity is, I am the be all end all. I know everything there's to know about botanical and herbal medicine. And there's nothing that I'm going to be able to learn from you or that you can teach me about it. Well, the truth is I can teach her plenty she doesn't know. Right. At the same time, she believed there is nothing that I would be able to learn from you. That's her identity on botanical medicine. And I just was like, and then you're right. And it's with great sadness that I don't want to be right because this woman's life needed to be saved. Being on a liver transplant list, I'm working with an individual right now. That's no little matter. That is a life or death situation every day. Right. So that identity, if you are identifying yourself as somebody where, I'm a super special rare zebra, no one can help me, that's a problem. Or I know everything there is to know and there's nothing I could possibly learn from you. That's also another identity. There are certain identities that we have where we become our own worst obstacle, is my point.
Absolutely. And first, the story you shared is very troubling.
Yeah.
Right. Because I know, and I'm sure the listener can feel it from you, that you are doing what you do to help, to make a difference, and it matters to you.
Mm-hmm.
And it's very like troubling, very sad. And
yeah,
the beliefs that we have
yeah,
matter. I like a broken record. I say this almost on a daily basis. I'm also, aside from the health stuff that I do, I ride mountain bikes, and I'm actually a certified mountain bike coach. And even though I know skills, if I have it in my head that I'm approaching an obstacle and I think I can't do it,
right,
there's no possibility that I can, and I'll fall down. And then I'm covered in bruises, right? And I use that story with the people that I work with because, for one, to show, hey, I'm human too. It's a human nature to have these thoughts go through our head. Well, what are we going to do with those thoughts? Right? So if I ask somebody to tell me, like, craft a wellness vision, and then I have them say it out loud, and then they're I sometimes people cry.
Yeah.
When they say it, because they say they feel like a fraud and it isn't them. And I said, I understand that this isn't how you feel right now, but do you believe it's possible? Like, what kind of belief do you have about your body? I spent, thank God I didn't spend years of my life believing this, but I spent several months of my life believing I was hopeless, believing that there was nothing I could do. And, seeing vasculitis markers and being terrified and my legs hurting so bad. And then knowing my dad, was 56 on dialysis, and, the specialist telling me, don't worry, as soon as it gets bad, we'll give you the medications and dialysis. I'm like, why is my immune system doing it? Because it's genetic. So I believed that was the end of the story. And I was falling down. I was walking and falling down. I could barely get out of bed. Now I ran 5 miles this morning, and it would have been that 4 months of my life that I believed that. I didn't even know if I could get out of bed and walk, let alone run again.
Yeah.
And the immune system is not something to be afraid of. It's designed to protect us. And the immune system is amazing. Well, so if it's dysregulated, I have to understand why, like, be inquisitive. Like you said, look for it, look for patterns and any other way in which we see that it's dysregulated. Like, how long has this been going on? What is it manifesting as? And if it's our gut, are we sitting down when we eat, or are we just really stressed out and pissed off and in the car and doing 10,000 other things like I was doing? I wasn't in a mind frame of rest and digest. Not even close.
So here's an insight here, and people, I think this is worth writing down. Your words are the immune system to your soul.
I love that. Your words are the immune system to your soul.
And what I'm telling you is that words really matter, and the word choice that you choose, all your words are choice. It's all choice. So every word I'm choosing right now is my choice. So the words you're choosing to talk about yourself, to talk about your body, to talk to somebody is all choice. And they are chosen by your identity, who you think you are, And so for me, when you look at the words that the naturopathic physician used, to me tells me a lot about her identity and her soul, right? Her immune system said, there is nothing that I'm going to be able to learn from you, which means her immune system and her soul and her spirit is, there's nothing, I can't learn anything new. I'm unwilling and I'm unable to learn and do new things, right? And I believe her. I believe people's words, right? Because to me, they're a very clear indicator of literally what her immune system to her soul is saying. What is she protecting? And where is her soul and her spirit, right? So in that sense, I really am and we do so much mindset work in all our programs. And one of the exercises we do is what we call an I am statement, which is what you call your wellness vision. And I remember, like, for myself, the first moment when I was on that bathroom floor and I said for the first time, I'm a smart person. I'm a smart woman. I'm a smart doctor. Of course I can figure out a way to do this. Like the first time I said, of course I can, felt extremely fraudulent. Extremely fraudulent. I didn't believe it. But given then, if I was to survive that situation, I had to say that. I had to say that to survive because I didn't have any will. My spirit had no will left. So the first time I said, of course I can, was hard and felt fake because it was aspirational. Now, here's the deal. Just because something you say and an identity that you want is aspirational doesn't make it not real. Doesn't make it not real, nor not you. We can have aspirational places we want to be spiritually. We want to be professionally. We want to be intellectually. They're just as part of us as us. Right? So don't really take your words really seriously when you think about your own body, how you speak to your body, how you speak about your health. So I highlight that I'm a super special rare unicorn, or I'm alone, or there's nobody that can fix this, or I have to have a diagnosis before I can get help. Think about these self-annihilatory sentences and words. Right? So I'm very big in one of the chapters, the first chapter in the book. By the way, you guys are all going to get a free copy. I'll tell you how. It'll be in the show notes. I'm going to gift every listener a copy. The first chapter on leading with curiosity, I talk about the questions that you should be asking yourself and of others that will raise your level of consciousness and identity, number one. And then in one of the last chapters of the book, it's called From Mindset to Mind Growth. I'm not here to work on your mindset. I'm only here if you're ready to grow your mind. And then my favorite sentence in there is about why we need to have mind growth so much is that your body's always following your mind. Your mind is the leader. So the body's always following the mind. So if we ourselves don't make the commitment and we don't work with practitioners who also made the commitment for themselves and for you, that they're going to grow your mind first, then your body ain't going to follow. Your body ain't going to follow. So the first thing is to work on your own identity is I'm a doer. I'm an action taker. I'm here to kick ass, take names, and chew bubble gum. Of course I can. When did that get taken away from us as kids? You said that shit when you were a kid, and life took that away from you. So we're going back to that. And it has to start there. And so when your mind is the leader, diggity damn, the body's going to follow.
I absolutely love that. It gives me goosebumps about that because this is what I say every day. And I say to myself too, words matter. They're not just things that we say that don't have an impact on our body. And the body wants alignment with what we say. Yeah. So, and I do this exercise with my patients. I say, I want you to smile really big at me and say, I am so depressed. It feels wrong. It doesn't feel right.
I like that one.
So if we are if the words that we're saying, and I'm human, I screw this up sometimes. I can be negative sometimes. We can have the thoughts that pop into our head. We can choose what to do with them. Mm-hmm. And this is another thing that I teach the people that I work with and you're absolutely right. Mindset, that's the first thing I ask people is after we do our deep dive is what are you willing to do? Mm-hmm. And they look at me and they're like, well, what are the options? I'm like, well, what are you willing to do? Because this is not me fixing you because you're not broken. Mm-hmm. This is helping you, guiding you to with pattern recognition to figure out what's driving these processes. But you have to be willing to do it. You have to be willing to change your mindset. You have to be willing to ask, why? Why am I like this? And another thing that you brought up, it's we're definitely two peas in a pod, that it's not about the diagnosis. Mm-hmm. And I get it because I was feeling like trash. I thought my life was over. And so I started running all of these functional tests on myself. What I want to know what else is wrong with me. What is that information going to do? Right. Obviously, there's all kinds of things wrong with me. because I already had all of these processes going on, and I didn't just catch it. It's not like, oh, I was walking around one day and I caught Hashimoto's.
Right.
This was brewing for years
Yeah.
because of my thoughts, because of my inability to slow down. Because I thought I'll sleep when I'm dead. Sleep doesn't matter.
I was pleasing in an abusive relationship. And that's why my body was trying to kill itself.
Yeah. Yeah. And to think that we have that kind of power inside of us, that we can either shift ourselves on that trajectory towards catastrophic disease and misery and death, or shift ourselves to optimal health and happiness.
Yeah.
That it's not always easy. So for those listening that are thinking, I don't know how I could ever, I don't even know where to start. I believe it starts with hope, with saying something like you said, Dr. Maggie. Like it didn't feel real to say it. Yeah. Like, am I a fraud to say this? But you said it. And so I tell people, I don't just want you to say it. I have them repeat it back to me. And by the last time, usually most people are smiling. And I say, do you realize you're smiling? They're like, well, I'm not sure why I'm smiling. I'm like, because your body loves what you're saying.
Would you tell your
body
daughter, let me ask you a question. Would you tell your daughter who says, Mom, I want to be an astronaut, would you say you're a fraud? This is what we're doing to ourselves. Your daughter says, Mom, I want to be an astronaut. You're like, you're a fraud because you're not. Really? That's what we're going to say? But we're saying this to ourselves and it's ridiculous.
Yeah, I'm gonna steal that one. I really like that. I love that one because sometimes we just need something to connect and have it resonate with somebody else.
Right.
Because like when I speak about the space and allowing the space, it can seem like I didn't believe it when this first like hit me in the face like a ton of bricks. Yeah. And I realized, okay, I'm going to have to make the decision right now. Am I hopeless? Am I a goner? Like, should I just not even get out of bed then? Is that what I want? Is that really what I believe? I was put on this earth so that I'm going to self-destruct. And it was very difficult because it took me saying out loud and like fostering this belief that it's possible. And then of course that self-doubt, what if it doesn't happen? I don't want to be disappointed, but what if it does happen? Right? If I leave the space, I believe it's the only thing that's possible to happen. And if we're still not getting there, if there's still something going on, uncovering like what's like the kink. I call it kinks. Like there's a kink somewhere. Usually it's in the gut. Like it's the gut until proven otherwise.
Yep.
But we have to have that belief system in place first. So if I have somebody come to me, we have an interview. Right. They don't know they think they're interviewing me.
I do.
It's both ways.
We do the
It's both ways. And if somebody just wants to know, what do you do? How are you going to handle this? How are you going to fix me? That raises like a lot of red flags for me, because then I put right back to them, what are you going to do? This isn't about me fixing you, because that's the mentality of conventional medicine, right? You have you get a cold. You get cold, they're not going to do anything. You get a sickness, you go, they tell you what's wrong with you. They give you the label, they give you the drug, send you on your way. In functional medicine, in root cause medicine, the way that it should be, and I don't believe it's like this a lot of the time either, that we talked about, but it should be, there's more to the story than that. It isn't just name it and blame it and a pill for the ill.
Well, I think unfortunately it's happening on both sides, where functional medicine doctors, because of the nature of the practices, time, or their training, are green medicine dispensers. I sell supplements. I make money off supplements. So I'm going to sell you a shit ton of supplements or IVs because that's how I make my money. And then interestingly is we have patients who basically took the model from conventional medicine and just says, I would now want to see a healthy functional medicine doc to get green medicine. So it's fed on both sides. And both are missing the point and the target.
It is. absolutely right, because there's these protocols for like some of these like real quick functional medicine schools and they advertise, get your supplement regimen dialed in. It's like,
well,
supplement regimen for what?
Get your sales funnel dialed in is really what they're saying.
Like, for what? Like that's such a huge red flag to me.
Right. But we're asking deeper and better questions. That's what we're doing here.
I love that your book talks about curiosity and that you're providing questions, like, just like we're interviewing the people who come to see us. People should be interviewing their maybe soon to be practitioner or whoever that they're going to work with, but asking the right questions. Not what are you going to do to fix me? Because again, you're not broken and they don't have that kind of power over you. But asking, their philosophy and thinking for yourself as just an individual. Like when I started,
this is where that chapter, I spent a whole chapter of my book on this, was because I also think that in the age where people can learn a lot of education on YouTube, and I have a big YouTube channel, I think that's wonderful. I'm not scared of the patient who learns on YouTube and Google and all that. I think YouTube University, I think it's great for learning about health. I really do. But here's the issue is people, I think because there's so many sources and many sources are not credible in online, free for all, Wild West, the public lack a way to have discernment to know truth from, I guess, these supplement protocol pushing money making machine people, let's say, right? So I think that's my biggest issue is how do we get the public to be more discerning so they know truth tellers and pattern seekers, right? Versus people who are just like literally sitting here like, take this wonder supplement for da 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 da. Like it seems like it's obvious, and people should know the difference between the two, but I feel like discernment is missing. So I'll have people who will say, I'm a skeptic. Well, okay. Just because you're a skeptic, number one, doesn't make you any better than anyone else. I'm going to tell you that right now. Skeptic is fine. You should have a certain level of healthy skepticism. But if you're a skeptic without any tools with which you have discernment to tell the diamond from the shit, then you're just a dummy. Like, I'm sorry. So I like you were talking about mutually interviewing people. Like I actually really love the educated person who comes to me who, let's say they've read my book. Let's say they've seen 10 of my videos on YouTube. We have like 1,500 videos right now on my YouTube channel. And so the one that comes to me and says, I've seen 10 of your videos and I've learned about, POTS or something. That person's going to be much better to have a conversation because I think that if you have an educator or you're learning to learn skills so that you can discern what's really quality and what's not, I think that's really missing in the marketplace right now for the consumer. So what I see is a lot of dummies who call themselves skeptic, thinking that makes them smarter when they talk to somebody like me and you. To put it frankly,
I love your realness. It's so refreshing.
I want to help people, but I also don't want to be annoyed by them or like be playing around with their own obstacles, right? I'm going to care just as much as you care. And unfortunately, it is the minority of people who care just as much as I care, like that about themselves and their own health. So I get super excited at your audience. Like the person who's at this point in the podcast, that's who the hell I want to work with. That's who the hell's going to get results. Not the person who has, Googled three things on the internet and comes and tells you, I'm an educated skeptic here. Pardon me, would you pass me some Grey Poupon? That makes sense.
It makes so much sense, right? And I've turned, obviously, I'm sure you have too. I've turned people away and said, we're not a good fit because we cannot want it more than the people we're working with.
And
if I want their results more than they do, and I believe it more than they do, they're not going to have success.
I'm not going to work against your resistance. And if you don't know what,
Yeah, like prove to me why. Prove to me why I should believe this.
oh, I'm not
Nope.
here to prove to you why what everything I just said here was genius, because it is.
I love that. I had one person once that they were like this. That was the position,
You know
and
what's
right
cool,
out of
though?
it, right out of the gate.
That's perfect. I love it. I
I'm
love
like,
it
nope.
because within the first 30 seconds, I can say, we're not going to be a good fit together. Best of luck to you. Like, you move on with your life. I want to move on with my life, because it's time they can't get back in their lives, and it's time I can't get back in their lives. Body language is going to tell you everything. The moment, like, if we lay eyes on someone who's like that, I'm be like, yeah, not good. Go somewhere else. They're like, why? Well, you should prove to me this or that. And be like, yeah, no. No.
I'm
Bye,
not proving
Felicia.
anything, because that's not. Yeah, that's not what I do is prove,
because you put out
prove
quality content.
what I do.
This is what it is.
And I definitely, I can appreciate somebody feeling discouraged, disappointed by the healthcare system, and maybe by lots of other functional medicine practitioners they've interviewed, because I had a couple of people tell me, they're going and making rounds, they're interviewing the different practitioners, and let me go ahead and tell them why they should choose me. I said, you shouldn't. I said, if yeah, because if that's the case, and I love myself, and I tell everybody I work with that you're the most important person in your life. That to the individual, I ask you, challenge you to every day look yourself in the mirror and say, I am the most important person in my life, and we don't have to jump through hoops for anyone else, right? And definitely shouldn't jump through hoops for other people. But also, we need to believe. If we don't believe, we will not achieve.
Well, it's just about really, if we're teaching people to have self-valuation of themselves and their own identity, we have to show by example our self-valuation. We have to know ourselves and our own identity be squarely in place. I know who I am. Do you? Really is the question. And when I see someone with certain type of body language, a certain type of words, I bring up questions to see if they have awareness around their own identity that's creating an obstacle or resistance. And if they're open to switching and changing that, cool. But if they're not, and as soon as I notice that that's not, I don't want to waste their time, right? And I'm not going to waste mine either, because I do value myself and my time and my love and care, right?
Yes, absolutely. And I want to be mindful of time, because I know we're getting close here. Dr. Maggie, for everything and I have so many other things that I want to talk about with you, but we might have to have you back on.
I love it. Let's do
it. I've got a list of lots of other things totally unrelated to what we're talking about, but I know it's things you're very passionate about, some of which you've already brought up. But I want to stay on topic, because I feel like this is such a value conversation that people are going to love, and bookmark this, come back to it, rewatch it, write it down, and look at all the links, the awesome links that are going to be in the show notes. But Dr. Maggie, for the listener, are there any other clinical pearls, anything that we have not discussed that you feel the listener really needs to know? I'm going to give them hundreds,
because I'm going to gift them the book. So it's 8 out of the box ways to transform your health, right? And we're going to provide a link in the show notes for you guys to get your own copy. If you're international, you can download. If you're in the US, you can get a hard copy of the book. I'm just going to gift it to you guys, because there's just so many things. And the other thing is, I think my YouTube channel, if nothing else, like whatever the topic, because I don't want to give one clinical pearl that it's going to apply to everybody. So look up my name in YouTube, Maggie Yu MD, and put whatever the topic you want to learn something about. And you're going to find one or multiple videos or an entire playlist dedicated to clinical pearls around that topic. So I'm going to say, do that, because you want to, like, if you are at the end of this and you heard the whole thing, and you have discernment, and you're highly open and educational and coachable. So I want to help you identify better and better sources for your own education and empowerment. So start with the book, and then there's questions in there that you should ask of every practitioner you work with. That's going to help draw those very same people to you.
I don't know why I was surprised at first when you said that. Now I see it is completely in alignment with you. And even though we're only meeting today, I don't want to give one clinical pearl because we don't know how that's going to resonate with that person. That I love. No one's ever said that to me before. And honestly, I like that. I love that. I love that because yes, how can we just say this is the one thing? This is the one thing. This is the magical solution, the magical tidbit, the pearl. Open it up. Here's your pearl. This is all you need to know when we're all different.
Right. I rather teach skills.
Right.
So what I do in all our programs is I teach skills. I don't give you things or one fact. I'm here to teach a skill. And the one skill that I love teaching the most is having incredible amount of curiosity and the skill of learning to ask better and better questions.
Well, Dr. Maggie, this has been absolutely fantastic. I loved every minute of this conversation. You are a breath of fresh air.
That was fun. I loved it. Thank you. And to those listeners who made it through here, can you comment in the comment section, like one thing that you took away? But I also, me personally, I would love to read the comments to find out what more do you want to hear about? What fire did this light in you? And if there's another topic that you want to hear more about, put into the comments wherever you're listening to this. I would love to see those.
I love that. Yes, to what she said, do that. And then when we have her back on, we will answer those questions.
I want to hear from you. Bottom line.